quality of life.
Okay, okay, okay.
Integrating into the society. That's another point.
Yes, yes. Anybody else?
It is a continuous process.
Exactly. Okay. So let us see what is recovery and what are the concepts and definition of recovery. Okay, next. So I am Denzel, psychologist. I have done my BSc, MSc in psychology and other things. Next. So I am born on this earth. I am belong to Animalia kingdom. I am a human, male, heterosexual, vegan, teetotaler, blah blah blah. So next. So let us go into the subject. So the second module is where we are trying to define what is recovery. So everybody has given some concept of recovery, but as a community of addiction professionals, they are also trying to find what is really recovery is. So we are here to see what is recovery and define recovery. And second thing is about abstinence in the context of recovery. And also we are going to see the 6 guiding principles of recovery. So what are the components in recovery, and how to take care of those 6 components, and other 2 components will be dealt by somebody else, recovery management and recovery oriented system of care and other things. Okay, so let us go to the next slide, please. So there is a lot of definitions on recovery, and William White, a researcher scholar, so in 2007 he did a paper. And he found 10 concepts which consist of recovery. So he went into details of 10 concepts, and with those 10 concepts he defined what is recovery. So he says recovery in experience. May I request any one of you to read that definition by William, please? Any one of you?
To read. Recovery is the experience, a process and a sustained status through which individuals, families, and communities impacted by severe alcohol and other drug problems utilize internal and external resources to voluntarily resolve these problems, heal the wounds inflicted by AOD related problems, actively manage their continued vulnerability to such problems, and develop a healthy, productive, and meaningful life.
Okay, so he was trying to define it. So there was no consensus, and so next slide, please. So here, this SAMSA is an organization for mental health professionals and addiction professionals. So they had a conference in 2005, and they sat together and they defined what is recovery. So can any one of you read it, please?
SAMHSA's working definition: a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential.
Okay, so we see that recovery is not only abstinence. Recovery is not in a de-addiction center, or not attending this AA group or other things, but it's a process. It's a lifelong process where an individual undergoes gradual improvement in their daily activities, self-care, in their health, in their wellness, and they direct their own life. They are not dependent on any other external sources. They define their own role. They plan their own life. They set a goal, and they slowly execute all these plans, and they reach their own full potential, and they live a quality life. So from addiction they slowly move into living a very quality life. So this is how recovery is defined. So it is from addiction to an end process would be in quality life. So this is a process. It's a lifelong process, and it takes a lot of time, effort, and so many stakeholders are involved in this process. So addiction is not simply a product. Just we give it to a client. So it takes so many things. So let us go a little bit detail into the next. So there are three concepts here. Is the process of change and a continuous growth and improvement functionally, and recovery management over a lifetime. So it is a process. So it is very time consuming and it really involves the patient. We can't push or pull the patient. We have to just go along, get his cooperation. We have to give the concept of recovery. We have to give the plan and other things. So it's very, very important that we professional should be very patient with each client. We have to understand them. We have to understand their family. We have to understand their professional. We have to understand their characters and other things, and we have to slowly define what is recovery for that individual patient. So recovery is a process, and we have to work closely with the patient to help him to attain his recovery next. So there are actually 4 elements of recovery. So I want each one of you to read one each here, please. 6. Hello.
Personal recognition of the need for change and transformation. The process of change can involve physical, emotional, intellectual, and spiritual aspects of the person's life.
Okay. So it is more change and transformation. So it starts into a transition process from a disease, a person suffering from a disease, and slowly into a person getting recovery. Next, please. Somebody else. No, sorry. Next element.
It is a voluntary, self-directed process. The person in recovery is an agent in this process, with the authority to exercise their options and make decisions based on their own recovery goals.
Sometimes we actually dictate the patient, do this, do this, do this, do this. So that may not help in a recovery process. So we need to evolve the patient there and get into a consensus, help the patient to define the goals and get a plan and all those things. So it is not we that who is profiling the whole process. It is the patient centric, and it's a voluntary process where the patient is the driver there, patient is the boss there, patient is the owner of his own life, and patient takes care of his own recovery. Next point, please.
Recovery. Sorry.
Yeah.
Recovery.
In health and well-being, which may
Yeah, one of
involve
you, please.
relapses as an natural part of this continuum, and it supposes the maintenance and the increase of the achievements reached over time.
Okay, so it involves patient moving into wellness, where he's having good appetite, sleep, urine motion, and is able to do his physical and daily routine self-care and other things. So it is and slowly evolving process. Next.
It implies the integration and inclusion and the construction or reconstruction of a life in the community through the construction or reconstruction of healthy family, personal, and social relationships.
So very, very good. So gradually he gets up into himself and he's able to do his self routine, self care, and his duties. And as he gets into the recovery process, slowly the family also is able to recognize him, and there is a beautiful transition, and people accept him. All those things happen. Next slide, please. So the first element is personal recognition and the need for change. So first, we have these 5 processes in recovery. First is pre-contemplation, and second is contemplation, where the patient stops agitating, stops defending and other things, and he slowly sees that he is into a disease and slowly recognizes the need for change, and he just neutralizes, stabilizes, and he thinks of changing his life. So this is a very, very important step into recovery. So it takes little bit of time there, and we have to intensively work with the client, because mostly he'll be defending and masking and other things. So slowly we have to break that and bring him to this stage. Next. Second, it's a voluntary and self-directed process. So we have to involve the client. We have to involve the patient. It's very, very important. Most of them will be hesitant and they will have a resentment against the family and other things. And he'll have so many reasons to defend himself. So we have to slowly evolve him and bring him into the process. Next. Next, please. So it's a continuous process. So once he takes care of himself, second, he does the preparation and planning. Third is slowly his whole self improves. And there are chances that once he's physically fit and other things, he is into a severe craving cycle where he wants to just get some kind of addiction and get into some kind of addiction. So there is very important that we give handholding to our patients and help him to continue in his recovery stage. So this is more into a maintenance part of the recovery. Next. The fourth is fourth element is integration and construction into community, where he rejoins his employment and he starts working, and where he is start functioning as a family head or husband or a father, whatever it is. Slowly is integrating into the family and the society. He goes to his normal function, socializing and family events and other things. So this is very, very crucial part of it, where he starts connecting. So opposite of addiction is not de-addiction. Opposite of addiction is connection. So this is very crucial part where he gets connected into the family and into the society. Next, please. So abstinence. So here very important is abstinence. So abstinence here is very important, and abstinence alone you will not consider as recovery. So sometimes patients stop using addiction drugs and other things, but they continue using what to say prescribed drugs. And I know patient who is after even recovery, they have given some medicine in the de-addiction center. He continues using those drugs even after 2-3 years of discharge, and he is without even informing the doctors, he continues uses the drug. So he is misusing the prescribed drugs. So it's very important that not only abstaining the addiction, but also the drugs that are prescribed by the medical officer.
Is it 50 minutes are over?
Yeah, please. Next, please. So what about nicotine and caffeine? So it's a stimulant. So I request the group to give your views. So what about, should we abstain from nicotine and caffeine, please? Group, just will take 1 or 2 minutes.
So, yeah, this is an ongoing debate which has no end. But the thing is, in a lot of 12-step fellowships, people say that drinking coffee or smoking cigarettes has not made my life so unmanageable as, let's say, using heroin or alcohol and, those sort of things. This is my narrative here.
Okay, very good. So there's still a lot of confusion, and they recommend that they stop smoking. The coffee would not really do any big long-term harms, but smoking nicotine is really dangerous and harmful. So we really ask the patient to abstain from that. Next, please.
Dr. Dennis, the time is up, okay?
Yeah.
Conclude.
So the important part of the recovery is wellness. So we all know that wellness is mental, physical, and social aspect of it. So we have to take care while we work with the clients on wellness. Next, please. So are you healthy? Please take care of yourself and take care of your whole holistic wellness. Next. Next, please. So these are the 8 components, dimension of wellness that WHO has defined. Next. So it's a process of change which improve their health, wellness, live a self-directed, and strive to reach their full potential. So there is the 2 definitions which was worked by SIMA, where 2005 and 2010. So there's a lot of difference between these 2 definitions. Next. So the recovery is possible. Never give up. Continue working with the clients. Next. So I hope you don't have any doubts. So next, please. So next is the most important slide. Next, please. Thank you so much. Love to cheer and celebrate life. Thank you so much. Bye.
Thank you, Dr. Dennis. Aditi, ma'am.
Yeah, Dr. Denzel, you made it very interactive, very calm voice, explained very well, involved all the participants. The only hitch I would say is there were too many slides. You could have made it absolutely half and explained in the same manner. You had a very good explanation. So no need of so many slides for 15 minutes. Because the last slides, we just scraped through it. We didn't even look at it properly. Otherwise, great presentation. Francis?
Yeah, the same thing, but I want to add something. As a trainer, you did well. Your presentation was good. Your knowledge level also is great. However, you took 9 minutes or almost 8 minutes for introduction. You see, you have been given only 15 minutes and you took almost 8 minutes for introduction, because you need to only say what is recovery and guiding principles of recovery. That is the syllabus. See, we are having training here based on our syllabus. I would suggest all of you don't have to add anything from other books or other researches. Just go by the syllabus, go by the manual, because we are sticking on to that. That's what I understand. Aditi ma'am will also tell about that. Yeah. So.
Yeah, I agree with you, Francis.
Yeah, that's okay. Thank you. Good. Anyhow, it's very good. Thank you.
Thank you, sir.
Yeah.
Okay. First of all, sorry, sometimes I call you Dennis. I'm sorry. You're Densil. Okay. Yeah.
It's okay, doctor.
Okay. Okay, Dr. Densil. Yeah, same. Like I was also feeling a little bit irritated with too many slides. Okay. Our presentation is not based on, I mean, the criteria is not based on how many slides you present in this short time. And many slides were actually you could have avoided. And your topic was what is recovery? In simple terms, like, no, it's very interesting if you can only stick on to that, no? What do we understand by the recovery? Like, no, that whole wellness concept. So I think you have explained well. I mean, as a trainer, fine, because you are already a professor. You have been training people many occasions I have seen. But keep these things into mind also. Yeah. What happened? Am I not audible, Francis? Yeah.
No,
anyway,
no.
So
I
keep
just
doing
short.
your work.
You're audible.
Yeah.
Audible.
So,
just this sign.
Yeah, keep moving. Yes.
Thank you,
But be very careful, because people, when they are sitting at your class, I mean, when you involve them, great. It is very good that you have done that. No, participant engagement was good. Only thing, restrict the number of slides, because I have mentioned in that topics itself, down in the footnotes I have mentioned, use very minimum, 3 to 4 I mentioned.
Yes.
But even if you use 5 to 10 also okay, but this is 30, 40 slides and all, no? So that's one problem. Otherwise, excellent, doctor. You are good. Thank you.
Thank you so much.
Yeah.
Next one is Clara. So
Clara is ready now, Clara?
take the floor.
Your guiding principles of recovery, your topic, okay? Yeah.
No, I don't know how to screen share. Let me see. 1 minute.
Yeah.
It's happening.
I think it's happening. Yeah. I'm doing it first time. So I thought, let me try. Yeah.
Slide show.
Yeah.
Slide.
Okay. Yeah. Thank you. Yeah. So thank you. And yeah, good evening and welcome for this. And thank you for this opportunity for me to, I think first time I'm doing this online. So this is, I just put a definition of guiding principles. Some things which I'm talking may overlap, which Dr. Denzel spoke. So this recovery from alcohol and drug problem is a process of change through which an individual achieves abstinence, improved health, wellness, and quality of life. So in the recovery, we have abstinence, improved health, wellness, and quality of life. So I have few questions beginning to answer yes and no. Recovery is a goal. Is it true or false?
It is true.
False.
It is
It's
true.
process. False.
Okay.
It's
Recovery.
false.
Yeah,
Recovery is a
recovery is a process. Recovery is not a goal. Recovery is a process. So the second one is a person who continues to, that Dr. Denji spoke about it. A person who continues to use nicotine after stopping other substances is not in recovery. True or false?
False.
False.
Okay, it's false because now it is considered as that person is in recovery, though there are no controversies around it. And also, I find it a big one. This nicotine issues, addiction. We need something like that. No, some kind of treatment for nicotine addiction. People are asking for it. So maybe in the later years it will happen. Nicotine also comes under this problem. So third, the person who is only abstinence is in recovery. True or false?
false.
False.
Why false?
False.
It's
Even
true.
relapse is a part of recovery.
No, not only that. It's basically, see, recovery simply means, like you said, achieving mental and physical health and living a self-directed life, and then, achieving one's full potential. So that is a process. And
Okay.
it starts with abstinence. But if
Yeah.
that person in recovery doesn't apply some
Yeah.
program of recovery to his life, then it won't be recovery. It will only be abstinence.
Yeah, but the person who is who is abstinent is in recovery or no?
Yeah, he is, of
He is
course.
he is in recovery because it's a one of the element of recovery. So
Yes.
yeah. So
If
he
recovery
is
is
in
like a
recovery.
building, then abstinence is only the foundation of it.
Yeah, abstinence is the foundation of it. So he is in recovery, but it's only a foundation. Foundation is required to build a recovery process. So the fourth is the profession has to be in the center of recovery, not the client. True or false?
False. False.
Thank you. That's
False.
all the
False.
questions. So relapse is inevitable in the process of recovery.
False.
False.
Okay, thank you. Yeah, I think so. I'll be taking these guiding principles. There are 12 guiding principles. In that, the first guiding principle is there are many pathways. There are many pathways for recovery. Also, individual have their unique strengths and needs, goals, all that. And recovery is highly personal. A person may not or may not go for treatment he can be from the it's like different kinds. He can go for a therapy and be in recovery, or he can go for counseling and be in recovery, or there are many pathways. So can you give me one, because I have just 15 minutes, so can you give anyone can give one example if there are different paths, any other path you know the path of recovery, which leads to these four things: abstinence, well-being, improved health, and quality of life.
12-point program?
Yeah. Yes. Thank you. Yeah.
Smart recovery is there, 12-step fellowships.
Yes. Thank you. So second one is self-directed and empowering. Recovery is self-directed and empowering. The pathway to recovery may involve one or more periods, because I can't see the last words. Recovery is fundamentally a self-directed process. In the beginning of the recovery, a person needs lots of support, like a counselor support or a doctor support, or so many other kinds of supports he needs. But the autonomy, the person in the recovery is the boss. He's the boss, and like other people are helping, or they're in the supporting, but fundamentally recovery self-directed and empowering. Okay. Third principle, recovery involves a personal recognition of the need for change and transformation. So this principle, like if we see many years back, like now also maybe few places, like people are forced or tied up, or and those kinds of recovery doesn't make much sense. That the recovery has to be personal recognition. The individuals must accept that there is a problem exists, and the person has to take steps to address it. The steps usually involve seeking help for a substance use disorder. So the process can involve physical, emotional, intellectual, and spiritual aspects of a person's life. So somewhere, can we think of an example here? Personal recognition of need of change and transformation, like a positive example or negative example, like somebody got tied up, and we can see, because we are all working in this field, we can see if what kind of trauma that person, like I have seen people complaining after going into a treatment center that they went through a very bad experience there, and that kind of. So anybody want to add something here? Am I too fast? Don't know.
I think sometimes, most often, clients will blame family, blame circumstances. So the blaming is a very common thing at the initial stage, where they're not taking responsibility. So
Yeah.
that's one of the things that needs to be addressed, and the trauma also, in order to be able to have personal recognition and recognize the need for change, is to address the resistance in the form of blaming and the trauma to be addressed.
Yeah, thank you. Yeah, that also, like, there is so much of stigma attached, and people don't know it's a sickness, and so they don't know it's a sickness, and it's like a shame to go for a treatment. So more of that kind of support or programs which can say that it's a problem. Maybe that will help. The person can accept now much better than before. Yeah. So recovery is next. The principle is recovery is holistic. Holistic is like we spoke in the previous session. The recovery has to be in every area of life. It is not only just a person I know, like once he is in recovery because I'm working in this field, or just wants to make money. So it's not good recovery. Or a person just into 12-step program, that's it, nothing else. Family life is not good, nothing, just meetings and or something else, like those kinds of. So it has to be balanced one recovery, then it can be called a balanced recovery. We have I can see one of my client who is sober, lady who is sober for last 10 years. Now beginning, she was just going for a few meetings, then later she started with the getting involved in her community work. Then now she last few months back, her home, she is into music. She whole family got into knowledge. Then she started teaching music. Then she's taking care of her children now. And like now they got some nice one good prize when they went for one competition. So it's kind of slowly that recovery can be holistic, and that yeah, that's what I wanted to say here. Recovery is holistic. Then recovery has cultural dimension. This is the next principle of recovery. Is recovery has cultural dimensions. Each person's recovery process is unique, and it has cultural. Every person has his cultural beliefs, and there are traditions. So a person's cultural experience shapes recovery, right? Because like we see, so one community can be very okay with alcohol or other drugs, using drugs, but some communities are very orthodox about it. They are not at all okay. So even when they come for recovery, when we understand their cultural background, it becomes much easier. And that's one of the principle of recovery. So yeah. I think I have 4 more minutes, so let me go. So the next one is continuum of improved health and wellness. Recovery exists in a continuum of improved health and wellness. So the recovery is not a linear process. It's not that will be ups and downs. I also hear that recovery is like a spiral. No, it's not spiral. No, we bind a book. No, like we spiral a book. So it's kind of no. It's not a very straight process. It's no spiraling process. So continuum is means like no, it's there may be relapse. Relapse is not a must, but there may be a relapse and setbacks. But even if he relapses, a person relapses, he is in recovery. He can like some progress is done. From there, he can start further. So we can think of example here also. I think I will go forward. Recovery emerges from hope and gratitude. This is one more principle of recovery. Recovery emerges from hope and gratitude. Individuals in seeking recovery from often gain hope from those who share their search for experience, search for or experience of recovery. They see that people can and do overcome obstacles, confront them, and they cultivate gratitude for the opportunities each day of recovery offers. This is we see more of whenever a person goes for a 12-step meeting. No, he gains hope, or a person who shares in about his her recovery with others. So he no, there is hope and there is gratitude. There is no like a person, even a doctor or a counselor or a therapist also can do that. No, give hope and say that no, this works, and no, like that also helps. And this is one of the principle of recovery. Recovery is a process of healing and self-redefinition. When I look at this principle of recovery, it's a healing. A person who comes for recovery has gone through sometimes lots of trauma, lot of bad life experiences, very low self-esteem, and so much of suffering. And that person redefines himself. Like maybe little growth and little growth and little more growth, and healing takes place. And the same person, like I have a person who came in who is shivering hands, and like very very tough situation. Family doesn't want him, wife doesn't want him, nobody wants him. But then slowly he started the program, and he did here 7-hour UTC 1 to 8, because now he's in 5 years in recovery. He did UTC 1 to 8. Today he is a counselor. He is taking care of other patients. So that is kind of he has gone through that healing, and that self-redefinition. He's able to handle things for helping others. So this is another principle. And addressing discrimination and transcending shame. As I spoke also about it, there is lots of shame and discrimination towards the people who have this SUD. So they also need to address. That's one of the principle of recovery: addressing discrimination and transcending shame and stigma. Supported by peers and allies. Recovery is supported by peers and allies. Yeah, my time is done. I have one more slide. I think I will finish in 1 minute. Supported by peers and allies. So recovery, that's one of the principle is that a person gets support from his peers. Rejoining, recovery involves rejoining or joining and rebuilding life in the community. This is also, I have no time to explain. So finally, recovery is a reality, and I have put all these principles in one slide to say that recovery is very colorful and definitely a person can recover. And yeah, with that, I close and thank you for the opportunity. Thank you.
Thank you, Clara. I think I liked your presentation.
Yes,
You involved participants with a quiz, which was great because you took some aspects from what people knew about recovery, explained well. What I liked more was you explained well with your own examples from practice. And that really added value to the presentation. Asked for clarifications and examples to other people who are working in the field, and you did engage people and they told you about their own examples, what they know about it. Very calming voice. Well done.
Thank you.
Yeah, Clara, you are very composed and calm. I think by nature also you are like that. Good, well done. You did very well. One of the good things that you did is you sticked on to the syllabus, the matter. You didn't go out of it. You took around 60 seconds extra, maybe because you added a little 2-3 things. That's maybe the reasons. But that was okay. That was fine. Exactly right. And your participant engagement was good because you asked so many questions. You also, like what ma'am said, you also added on your personal experiences. Actually, training is what important is when you bring your personal experiences into to the participants.
Absolutely.
Because yeah, that's how we learn things. Absolutely, that's how we learn things. Because addiction is still a new science, a new branch of science. We are still learning. We do not know. Day after tomorrow, somebody comes and tells that addiction is not a disease, it's a personality defects. We don't know how they are going to prove it is because it's a new science, entirely a baby. We are still learning. So it's good, fantastic. Keep it up. Thank you.
Thank you.
Francis, can I just make a comment? Actually, this Gabor Mate, he's one of those people who talks a lot about addiction, and he claims that it's not a brain disease, it is trauma related.
Oh,
so
okay.
Yeah.
Okay.
So now they're actually questioning the fact that it's not a brain disease, it's trauma related, and if you deal with the trauma, you can recover from addiction.
That's
Because
true.
the
But
trauma from childhood trauma.
that's okay. But for anything and everything, you need to bring evidences. Let them prove it. We will accept it. Yeah. Let them bring the evidences. Let them bring the evidences.
Maybe trauma is linked to the brain also, no?
Yes, it is.
That's true. Yeah,
Actually,
that's
Loyola,
true.
it is trauma related, but trauma, as Thomas said, is also related to the brain.
Yeah, right.
Yes, ma'am. That's what we're learning in WISE curriculum now.
Correct.
That trauma is
Absolutely.
related to the brain as well.
Absolutely.
Okay, Clara, congratulations. Okay, you said that it's the first time you are
Thank
doing online training and all, but you did with a lot of experience, which shows that a person with the clinical experience, they become the best trainers. No, that's the thing. Though ICAP and all, they say even without clinical practice, you can be a trainer, but trainers become real trainers when they're practitioners. You had been in the field for last 10, 12, 20 years. So that was very clear, no, from your personal experience sharing, linking it with the principles and all. Beautifully done. I think it was very calm, quiet, cool, interactive, and then people were stick on to you. That's what, no, the trainer's main asset. So thank you, Clara. Congratulations. Go ahead. Your mission. Thank you. Next person.
I think next is Sheetal.
Yes, I'm ready.
Sheetal, ready?
Go ahead.
Yes.
Yeah. Okay, Sheetal.
Okay. I'll just share the. Can you please share the PPT? Okay.
Okay, 1 minute.
No problem.
PPT is with the link.
Sharing.
Okay.
Okay,
Thank you so much. Good evening to everyone.
Okay.
My name is Sheetal and I'm your today's trainer. So as Dr. Denzel were talking and Clara ma'am was talking about recovery and recovery principles as well, isn't it? But when it comes to recovery, can we actually predict who will do better and who will not do better in treatment? It's very difficult, isn't it? And there are many factors which probably can influence the treatment outcomes. And that's what brings us to this topic. But before going ahead and digging into this topic, I wanted to ask a question to the group. Give me one answer. One volunteer can probably give answer to this. If we know what recovery is and what are the factors which can affect the treatment outcome, how are we going to use that information as professional addiction therapists? Can anybody? Can anybody?
Yeah, I think the first thing is to inform the client that it's a disease, and it is not a curable disease, but it is treatable, and that recovery is the process, a lifelong process, hopefully, and that process has a content which, if followed, will certainly result in recovery.
Okay, thank you, Raman, for giving answers. But when we are thinking about factors affecting treatment outcomes, if we collect that information, that will also guide us into two important areas. One is treatment planning, and other one is case management. What are the services needed for this individual? And these factors will decide how can we manage this case better. Thank you for your answer. So let's go ahead and see what are we bringing on board with this topic. So at the end of this session, everybody will learn and understand what is the social determinants factors which influence the treatment outcomes. What are the 4 different categories of these affects these factors, and then also we'll give in examples of all 4 sections so that we know how to document that and use it for the treatment plan and case management both. Let's go ahead. To understand the social determinants, the formal definition is here. You can actually wanted to take a picture of this, please go ahead, but I want to keep it more simple. So when we think and define the social determinants, we are thinking of the conditions and the system which people live in. What conditions means that where they born, what kind of environment they are a part of, what work they are doing, what age they are in, and so on. But apart from these particular parts, they also have a bigger systems around them, like a political influence, social norms, and so on. And all these 2 factors are basically shaping their behaviors. So this will be determined under the social category. When we think deep about it, we do understand that this is also a cause for inequalities in the health providing systems and so on. So to understand how does this inequalities in health at different levels we can assess and we can think of, the next model will help us give a deeper data in it. Look at this model. This model is known as multi-level model, which is designed by Goran Dahlgren and also Margaret White. This model talks about different classifications of inequalities and different parts of it. This model focuses on 3 things. How is this individual? How is his environment? And how is it affecting his disease and health? So this comes from center to the end. And that's why this treatment model has 2 different names. One is the socio-ecological theory model, and second name, the most famous in 1991 and 92, this model was always referred as the rainbow model, right? So let's focus on the center part of it now, the orange dot which you can see. The orange dot talks about what is this person's age, what is this person's sex, and also constitutional factors. Now, when it comes to constitutional factors of health, what are we referring to? We are referring to genetical burden. We are referring something which they will never be able to change, like their race, like their family history, the genetic conditions which they have. So that is a part and parcel of the constitutional factors along with the age and sex. Then let's think about a next window of it, the rainbow color of it, individual lifestyles. So what peers they have, what lifestyle they are in, choosing a cigarette, like whether I want to use a cigarette, whether I don't want to use a cigarette. That's a part and parcel of lifestyle and individual decision-making skills and so on. So that will be covered in the second section. The third section talks about how the society and community network influence his environment and his health. So if we go back to a couple of decades back, when the AIDS was new, when HIV/AIDS testing was very new, we know how community and society networks reacted to it, and how does those reactions positively or negatively affected the individual's health and healthcare services at that point of time, isn't it? So explore it more. When we think about the green area now, the green area talks about the social social community has so many things, but now they also focus on living conditions of individual. Where do they work? And this also has from basic to bigger commitments, like what kind of housing they live in, what kind of employment status these people have, what kind of healthcare facilities they can reach out to, what kind of education and other important parameters they have in this circle. So these living conditions will define overall status of the culture, economical, socio-economical branch of it, and an environmental condition this person is part about. So it starts from the orange dot and then it reaches to the end levels. This will give us a better idea that in each section, what are the differences and inequalities we can see, to before we go ahead into many other different factors. Can somebody would like to point out that when we think about constitutional factors in the beginning, what was it apart from the age and sex? Can somebody?
The genetic factors you're talking about?
Yes. Thank you so much, Devika, for answering that. Okay. But and any other factors are very clear to and easy to understand. But the constitutional factor of health plays also a very important role in this model. Let's go ahead and think about what are the other factors also we need to consider when we are making a list of factors. Now, these are the factors which we are talking about. The factors which has individual characteristics. Say, for example, this person has an insight. This person comes from XYZ social strata. Then comes the nature and severity index of this problem. So we know that people in addiction also has history about head injuries or other comorbid issues like mental illnesses and so on. That makes the complexity little more for recovery, and that will definitely affect the treatment outcomes. Then comes in the process that what is a treatment center providing them, and what processes as a part and parcel of treatment they are going through. We also have seen that people go to even dargahs before going to the hospitals, isn't it? So that is also part and parcel of what processes they are considering as a part and parcel of treatment. Then comes the environmental social conditions, how much stigmatized the disease in the society, that will also reflect in treatment outcomes, the institutional factors and family factors. But to conclude this, we are basically thinking on one parameter, that the listing is important, but at the same time, we need to also understand that their interactions among each other are also a bigger influence. Say, for example, the individual characteristics will reflect in family factors and so on. So let's see, can we make it more simpler? So if we want to make a list, it can be bigger and bigger. So to make it more simpler, we'll divide it into 4 sections. The first section is about individual factors. The second section is about program factors. The third section is about social and familial factors. The fourth one is about gender issues. Okay, so we'll go from end to first. The gender section is the gender issues are what? If somebody gets a people from LGBT community and he wanted to continue with his abstinence and all that, the risk factors and the other factors which will influence his treatment will be way too different than the people who come from a heterosexual community. And we need to specially give attention to those demands of that individual. Also, it comes to social and familial. If the family people have codependent relationship with our client, it will definitely reflect in the treatment outcomes, isn't it? Likewise, the stigma in society is also one of the example of how the society and familial factors can affect the person's recovery. Then comes the program, the length of program, who are the service provider, what is the quality of service providing agencies and so on. That will affect the treatment again. And the last one is the individual. Like we earlier said, the insight, the education, the employment status, and so on. Now, when we are thinking about these 4, whenever we get a case history of anybody's, any client's case history in our hand, the positive points of it and also the negative recovery capitals of him, we can actually think about segregating this in 4 different sections. So here ahead, when we are thinking on case, we are thinking about planning of treatment and services which we wanted to provide to him. Let us do this analysis. The positive points also in 4 different directions we will write, and also the negative recovery capitals we can bifurcate into all 4. Now, when it comes to practicing this, I'll make it more simple for you. I'm going to give you a statement and you will tell me that statement comes from which factor. Are you ready?
Yes.
Can we open the poll? Yes. So let us go ahead with the poll. Can you help me?
Sure, one.
Roshan, can you help me, please? I can't see the poll
Yes,
button
yes.
here. Yeah. Yes. Yes. Let's go ahead. You have 6 questions, and we have 30 seconds for each one. Let's start. Can everybody see the poll? Yes. Yes, please. Read the statement and identify whether it comes from individual factor, program factor, social factor, or gender issue factor. Thank you for answering. Okay. Most of you have covered at least 3 questions so far. Great. Okay. I can see people reaching at 5 now. Okay, great. Okay, we have another 30 seconds to finish. Great. Most of you are able to answer. Okay. Thank you. We can end the poll now. Okay. I would like to share the results also with all of you. Okay. But before that, I'll give the correct answers. We can actually share the poll results. Okay. So the first question was about the psychiatric issues. Can it complicate? Yes, it can complicate. It's a part and parcel of individual. Those questions which are 100%, I'm not touching them because it means that everybody has answered right. The 4th question, the category says that dependency on one or more substances, can it complicate? And what is this? Is it a program factor? Is it a social factor? Is it individual factor? Because this is the one individual facing 3 different issues with different substances, and every substance will have different effects. So his case is becoming complicated on individual factors. Okay, then we'll go to the 5th question. The relationship issues seems to play bigger role for women or men specifically. That's what this question asking about. So it definitely has a social context, but it's more for gender. Right? And the last question was about codependent relationship with partners. Even that question seems to be a little confusing for many, but codependent relationships are the familial issues, Thank you for answering. Everybody has done really great. So at the end, what we are looking at is we have understood that there are 4 different things as a part of summary. We know that now there are individual, program factors, social factors, and gender issues. We have also touched upon what are different things about social determinants of health. If you have any questions, the portal is open now. Thank you.
Thank you, Sheetal. Again, very well done. I like the way you use the polls, and it turned out to be very interesting. Everybody involved in that explained well, gave clear examples of each factors. By involving the participants, you asked a few questions to them, and very clear and calm voice. Well done.
Thank you, ma'am.
Yeah, Sheetalji, you have done
Yes.
very well,
Thank
because
you.
I would appreciate you for using all the possibilities of online virtual training, especially the polls. We have not used this technique, and ensure that now you can be a good trainer on online too.
Thank you.
Other aspects like your knowledge level is good, no doubt, excellent. You engaged participants. Your demeanor was also good. And absolutely the time management was absolutely excellent. I appreciate that. Thank you.
Thank you. Thank you, sir.
Thomas?
I'm waiting to hear from Thomas, sir, as well.
Thomas, I can't see him. Oh, Thomas, are you there? I think he may have lost the internet or what?
Aditi ma'am, can we also have, like Dr. Thomas was saying about a technical thing? Yeah, like, because what Sheetal did was really nice, that poll thing, but we don't know how to do these things.
Yeah.
So if we could get some help over there, like, different things like these sort of things which we can do add-ons, or
Sure.
even how to show a video online.
Sure.
Those kind of things.
I think we can ask Dr. Thomas to have another session for maybe 1 hour to show the technical gimmicks on the online platform.
Yes, Aditi, I think that was one thing which we did not think about. No, we should have it.
No, so let's see what people know, and now we can always have it.
Yeah.
We can have it. Loyola, it's a good idea.
We can have it, yes.
Yeah, Thomas, you
See,
can write it down. Yeah.
Because Loyola, even today also, I was seeing only your upper part of your head, no. So that is one important thing when we are speaking to
Yeah.
others.
So we'll have a session, at least for an hour. After we finish this.
And maybe before the session, if we can all put forward like doubts about technical things, then those things can be addressed. Otherwise, like if we can
That
put
is a
in the
good suggestion also.
what
Everybody, put your,
Yeah, I mean,
what do you expect?
Roshan only helped me actually in doing polls. I just wanted to clear with him ki, can I do this? And he said, yes, we can. And we have done the trial in the afternoon, and he was very quickly responded me and feed my data in the system. That becomes very easy for me. So I think it is also about asking for help,
Yes,
So,
Sheetal, yes, absolutely. So not everything we know, but there are technical people available,
Yeah.
you know that. It's only that you have to ask for help and do a dry run. Like she said, in the afternoon, we tried it. So you can't last minute wait for it.
Yeah.
Yeah,
That is
we
one of
put
the
in our
qualities of a good
suggestions, what
trainer,
we
no?
need. Yeah.
That one of the very good qualities. You ask and get help, when you are presenting. It's a responsible job, no? That also is important. Yeah. Okay.
Yes. Okay,
Thomas,
so
sir, I want your comment on my presentation, please.
Yeah, please. Aditi, ma'am.
Oh,
No, we did.
Thomas, we finished.
You did. So
I was waiting
you
for your
understood a
comment.
little bit. I was off for someone came here. Okay, fine.
sorry.
Yeah, what I really understood is that you are a practitioner for so many years, so you cannot be a bar trainer at all. That was my preconception. So I was watching, and you are red, green, blue, and all. No? Somehow you were putting things in a different way to people, and which was working. And that asset is you are a practitioner. You have a lot of experience as a clinician, so you can very easily, put forward what you have in mind, to the people in a convincing way. So that has been happening. So I think it was no way lesser than anybody else. You were very good in your presentation. You are very confident, and I like that poll also. That kind of things engage people forcefully. Like even if some people are sleeping, when you have a poll, they will definitely do that, and then you immediately results were there. So those kinds of things are very good training techniques. So congratulations. Go ahead. Thank you. you would do well. I know. Thank
Okay.
you.
Do we take a break now or we go ahead with the
Yes,
second
we
part?
can take a break, ma'am. Yes,
5 minutes.
5 minutes. Okay.
Back soon.
Who's going
Yes, ma'am.
next? Is it Geeta, Raman, or Dr. Sulekha. That's what the names are. Any one of you? Nobody's going today?
Yeah, we can start, no?
Yeah, but who's going? Nobody's
Who is
wants to-
next? Raman, you can take over also. Did you send your PPT to Roshan?
Yeah, I got it.
Did you got it now, Roshan?
Yes, I got it.
Where is
No.
Raman, but I can't see him.
Raman is here.
He escaped.
Break.
He always
went
escapes.
away.
This is the third time we are making arrangement for him.
Yeah, it's break time.
Or who is the next person?
There is Geeta. Who's Geeta?
Getta.
Geta.
Geta.
And
Geta has not come. I have,
Dr. Sulekha.
I have mentioned in that some names now already.
Yeah, that's what I'm reading.
Sulekha ma'am is not there.
Getta, Sulega, Remya.
All have come back. Remya, what happened? You have shifted with somebody, I think.
Yeah,
no?
Raman is here.
Sir,
Raman
I
is
had switched with Sunisha.
But if you are ready, you can present also. Raman is the Dr. Suleha has not come. She may be having lot of
No, Suleha is not here.
rain problem there.
Raman, are you ready?
Jetta
You want
has
me to
not
share?
come.
Yes, I can do. Although I'm not so well
yes,
prepared.
then.
And
Raman,
my
you have
mind is
come
in
now
100
also.
places. No problem.
So who is going to do first, Raman or Ramya?
Ladies first, no problem.
Okay. Ladies first. Okay. Ramya. Raman is so scared now, taking session. That is why. I know. You have shifted. Okay. Ramya, over to you.
You mute.
Ramya, you unmute.
Sir, actually, I just need, I'm just not fully prepared with my presentation. So that's the thing. So.
You are supposed to be fully prepared. Today was your day according to the timetable, na? No problem. You can.
Okay, Raman can go first and then Ramya.
Yeah, meanwhile, yes. Okay.
Okay,
One more person
okay.
will be there today. From the next day, one more can get ready, okay? 3 people have
Raman, should I share now?
Yes, please, Roshan.
Yeah. Raman is going to speak about social stigma.
Yes, I'm going to speak about social stigma, but by itself, it's a very large subject. Therefore, I'm confining myself on how it affects people seeking treatment and recovery from substance use disorders. Thank you. Next one, please. Okay, I would like to ask the group, would one or two of you like to, just offhand describe what is social stigma?
Person is discriminated.
Pardon me, Clara, I can't hear you too well.
Or the person is discriminated in various forms.
Can you increase your volume on your laptop?
The person is discriminated.
Yeah, that is one thing. Yes, sure. And anybody else?
The social disapproval of particular behavior or particular.
Yes. So the person feels isolated and not part of the community. Yes. Next slide, please. Yes, this is the description of definition of stigma as we find in UTC. But thank you both, Liba and Clara, for your definitions on the next one, please. Okay. We also are seeing here that there is things called labeling, stereotyping, separating, and the separation is what actually sets up, the environmental factors. When we talk about that, what sets up people for getting addicted to drugs is one of the main things is this separating. It's a manifestation of other things, but ultimately this is the deciding factor. That's why in recovery, they say it is better to be with the recovery community than I think Denzel also mentioned that the opposite of addiction is connection. So when people discriminate against me, they stereotype me and label me as an addict, junkie, etc., no good and all that. Because of the shame, I feel apart from people. Yes, please. The next one. Okay, discrimination occurs when individuals with SODs are, yes, we already went through this, but can anyone give me one small example of discrimination that you have seen or experienced yourself?
Psychosis or mental health disease.
Okay, so when person has a psychosis or mental, they're, the very, very stigmatizing language is he's a mental case, is this thing, so yes, that once again separates people from the community. Yes, next one,
Aman,
please.
I have one.
Yes, doctor.
Yeah, I have one student who was an cannabis addict, and he recovered, and we tried to get him for 11th standard. No school admitted him because we openly told him that he's not using and he's recovered, but no school was able to take him in. So there's a lot of discrimination there.
That's a very good case in point of how people with SUD are discriminated in spite of the fact of it being a disease. Like nobody wants to become a diabetic, but they become diabetic, then they get treated. But why is it that people discriminate against people with SUD? This is the mute question. The next slide, please.
Even jobs, even getting jobs.
Yes, exactly, Lola. That is exactly what this also says. The social stigma, not only being, not allowed equal opportunities, but being denied jobs outright. And even if they get a job, there might be problems for promotion or inclusion in core teams, etc. Yes, please, next slide. Okay, can anyone please give me a read of this social stigma?
A person who sees that addiction is stigmatized may feel shame and be reluctant to seek treatment. Social supports for recovery may not be adequate in a community that stigmatizes addiction.
Yes. Now, the key words there are shame and stigma. They go together. And psychologists have also deemed that shame and anger go together, stigma and shame go together. So these are the things that a person in recovery who has faced a lot of stigma needs to contend with. Next one, please. And before we go any further, you see, basically, social stigma is it's a social science subject. we are not able to quantify it. Therefore, this entire study, I'm presenting only slides. There'll be no diagrams, no illustrations, etc., because then that would become quantitative. So I'm just keeping it at a very qualitative level. So please understand that. Thank you. Yes. A stigma study. Yes. A number of qualitative studies, like I was saying, have provided an overview of the stigma experiences for those in need of treatment for substance abuse. And once again, it reiterates that feelings of shame, embarrassment, and guilt were reported. So there might be a slight difference here, guilt and shame. When guilt is a feeling which tells me that I'm wrong. When I was young also, people used to tell me I was wrong, but I never admitted that it was wrong. Therefore, the guilt progressed into shame. Now, guilt is supposed to be a good emotion, actually, where we can correct ourselves and say, yes, I'm wrong, I'm sorry, or apologize, or, correct or amend our behaviors or words or actions. However, when we don't resolve the guilt, it results in shame, and which once again is part of the stigma spectrum. Yes, please. Can somebody read the next one, please? People with SUDs. Can someone
People
please
with
help me?
SUDs also reported a need for secrecy about both their use and any attempt to seek treatment.
Yes, in the next one too, please, Lola.
Feelings and need for secrecy stemmed from a strong desire to avoid accepting the identity of addict or junkie.
Yeah, so the question here is, people have a hard time, accepting. When I'm called an addict or a junkie, I immediately reject that notion. So that is also a finding of the stigma study, that when people are called addict, junkie, drug addict, abuser, etc., they automatically reject. So our rapport building there becomes very difficult, because we want to help the person with the SUD, and for that we need to have person-centered language, which will come up in the next few slides. Thank you. Next slide, please. Yeah, stigma negatively impacts recovery. How? Like Luella said, employment is a problem, and you can't get housing. And like Denzel said, you might not even be able to study because people came to know of your dependence on psychoactive substances. And healthcare, yes, sometimes healthcare also becomes difficult. And most important is acceptance by family and friends. And friends, let me tell you one thing. I've been in recovery myself for almost 35 years now. And till today, there will be instances when family will not invite me for their 70th birthday or something, because they'll say that guy was a drug addict. Why should he be here? And also went through a divorce also. So they'll hold that against me. And imagine the plight of someone who has co-occurring disorders. They have had a SUD, then they had mental health issues, etc., etc. They went through a divorce. Imagine having to cope with all that. Really, it is a lot of correction has to be done in society to address this shame and stigma that a person with SUD has to face. Yes, next one, please. Yeah, now very important. The general language that society uses can be described as the language of stigma. They don't know otherwise. The thing is, they don't have a vocabulary to describe a person who's, obviously, a person who's using drugs on a very compulsive level, or, who's become addicted to. Obviously, they are destroying their lives. They're destroying the happiness of people around them. They're a burden to society, etc., whatever. And, they find it hard to cope after some time when the addiction becomes very strong. However, if we want to help them, we must reject the language of stigma. And these are some of the words: drug addict, druggie, stoner, throwaway, being high, abuser, etc., etc. And these are the things that prevent us, healthcare providers in the field of treatment of addiction, to approach the people with the problem and build rapport with them and evoke in them a desire to change. Yes, next slide, please. Yes, this is a moot point. You will still hear today in meetings of Narcotics Anonymous saying, my name is so-and-so, and I'm an addict, and I'm clean today. Now, that is in a different context. Like they can use the word clean also if you go for a blood test. If you're in a treatment center and you've been, you are out in the you're back in society, and however, there is a caveat which says you must appear every 15 days for a blood test to see if you've used. Then if they say, yes, your blood test is clean, that is all right. But to actually say, hey, the guy is clean today, would imply that previously they were dirty. Would you call a person with cancer? I mean, nobody wants cancer to happen to them, but it happens. Would you call them dirty? So why do you call people with addictions, why do you call them clean and dirty and discriminate? This is our question to society, especially when we come into case management and advocacy. This is a very moot point to consider. Thank you. And next slide, please. Okay, would someone like to read people first words here?
Person with a substance use disorder.
Yes. So is it better than saying that he is a drug addict or junkie?
Yes, it is.
Yes. So Clara, I'll ask you one question. Why is it better to call a person with a substance use disorder than a drug addict or a junkie?
Yeah, it's a stigmatizing word. So it's better.
Yes,
He's a person
that is right.
with the illness. He's a person
Yeah,
with
but
the illness.
what
He's not
else?
bad.
That is right.
Also, we are not harming his dignity.
That is right, Chatura. And we are also stating very clearly that this is not an inevitable condition that has to exist in that person for the rest of his life. When we say that there's a substance use disorder, then it can once again be managed and person can become all right. But when we say the person is a drug addict or a junkie, we are equating that person with the disease and saying that is him, which is a very wrong description of that person. It is not a person-centered language. It is not a people-first language. And UTC teaches us to put people first, to put the client first. Next slide, please.
Raman, it's like calling a person a liar rather than saying the person tells lies. The person tells lies.
Exactly.
Instead of saying the person tells lies, you call him a liar.
That's right.
That means that person is nothing else, only the person is a liar.
Yes. So expect whatever you ask questions of him to expect a lie, right? That means when we say that person is yes.
With the addict also, the person is an addict means he's only an addict. No, I mean, when you call him an addict.
In
Yes,
fact,
and many of sorry,
we should not be labeling anyone because it's the problem that they have. We should sort of differentiate the person from the problem. We should not sort of see them as okay. It's something like somebody who has this schizophrenia. I have heard so many of even the professionals itself. I have seen them as calling as schizophrenic. You don't call anybody schizophrenic. It is a condition that that person has. So labeling is something which should be just kept out of all this. That's
I fully agree with all of you. In fact, society has a very old lie, and it's called once an alcoholic, always an alcoholic, once an addict, always an addict. Have you heard that phrase? It is a very
everywhere.
Yes, it's a very dehumanizing, because that, like we were discussing, that identifies a person only as that, not as a human being, as a person with dreams, desire, and nobody actually becomes an addict willingly, no? Nobody gets addicted to these things willingly. Do I go out and say I want to become an addict? No, it just happens because we have the disease, we have environmental factors, etc., etc. But having said all of that, in recovery, when the person comes to recovery and seeks our help, we must be able to make that person feel comfortable. And from a human point of view, we must be able to, edit our language also. And I would like to ask one of you, in summary, the perception that those with addiction are somehow less human or worthless. Can you, one of you, please read it out?
Can lead to self-fulfilling prophecies by believing that people suffering from addiction cannot recover or play a positive or productive role in society. Lead to discrimination, example, employers not wanting to hire anyone who is in recovery. And lead those who are addicted to feel hopeless and reluctant to seek help.
Thank you. Thank you. And next slide, please. That was the summary of the study. Yes. Yes. And the next one also, please. We've already discussed. Yeah. We have to be very careful not to use any sort of stigmatizing language. And also another principle is, if by accidentally I use some stigmatizing language which I'm not aware of, I must also be willing to say, hey, I'm sorry, I didn't mean that. I didn't mean that at all, and be humble enough to accept that I was wrong. I think I'm finished with that. Thank you very much. Thank you all for participating.
Well done, Raman. Very confident, very clear diction. You gave examples from your own practice and your own experience, which actually added the richness to your presentation. You brought out you elicited examples from people, and they were very well involved. Great job.
Thank you, Dr. Aditi.
Francis?
Ramanji, you are always you are always good and excellent. Your knowledge background is very good. What I wanted you to change is, you just copy and pasted the what do you call the PPT. I saw that. Yeah. That's okay, but put it in a little more attractive things in your PPT. Maybe will, people get initial attraction towards the presentation style. That's all I want to say. Otherwise, it was excellent. Thank you very much.
Thank you, Dr. Francis.
Yeah, Mr. Raman. Raman is not only a good singer, no, you are also a good trainer, no doubt about that. An international fellow.
Thank you.
But some of the things which I observed, I think beginning, because when you are speaking about social stigma, that is the topic, no? So
Yeah.
I was thinking that, no, you should have given a little more time to explain what is social stigma. You just asked two people, they said one sentence, and then you did not actually spend time with the definition, because when we are speaking about that topic, the definition is important, no? Like, what is stigma? A little more. I thought that is one small observation I had in the beginning. We just jumped onto the other part very fast, like, no? So maybe that we can also, because that is a topic, like, no? Otherwise, it's very engaging, very confident, very good, like your powerful voice. All these things are really, really good as a good trainer. I'm sure that you would be doing very well as a trainer in future. Good asset for us. Thank you.
Thank you, Dr. Thomas. And I would like to
Congratulations.
admit one small secret here. This afternoon, I was
Mhm.
not ready. I phoned Dr. Thomas and he said, it was at 4 o'clock. I phoned him and he said, just do it. Just get ready. I
Yeah,
tried to
yeah,
fit.
yeah, yeah.
And
And
thank
this
you for
is a
that
topic I
encouragement.
know
See,
you
that's
know
why,
it.
yes, that's why they
Yeah.
say the things you want the most is on the other side of fear. Thank you for helping me to overcome that fear bottleneck. Thank you very much.
You okay? Who else is there? Is there anybody else today? But I have to make it very clear. If you miss your scheduled time, it will be very difficult to accommodate you on the next day, because next day priority is the next day people. You cannot cut short them, like, no. After that, if there is time only, we can give people who miss the schedules. Okay, so that you have to keep in mind. Sometimes.
Dr. Thomas?
Is there anybody else today? Yeah.
Dr. Thomas, can I present now? Is there anybody else
Oh, yeah,
present?
yeah. Oh, great.
Because-
Okay, who is it?
Because
Sulekha,
the
ma'am.
net connectivity is very bad. I don't know when I'll be off. I don't
No
know.
problem, Sulekha. Go ahead. Go
Already,
ahead.
whatever
I'll share
way,
the-
whatever way, we were just
Mhm.
struggling through the net connection, both of us together. All right.
Both of you are there, means it will happen. No problem.
Share the slide.
All
Yeah.
right. So
Okay.
I think,
All
is there
the best.
anybody
Go
else
ahead.
presenting now? Can I
No.
do it?
You are the right one. You
Okay.
are
Thank you.
scheduled
Thank you.
It's a Sulekha now, because
Yes,
it's written
Sulekha,
Venugopal.
Okay.
Sulekha.
It's written Venugopal. Yeah, I'm Sulekha Venugopal.
Okay, right.
Right.
Where are you? I can't see you anywhere. You are
Yeah,
there.
I'm
Oh,
here.
you're
here
not.
it is.
Oh God.
Okay.
Yeah.
Mhm.
All right.
Yeah.
Ronnie, I mean,
That's the slide,
Roshan
right?
is already with the job, but before that, I'll just have a little brief thing. My topic is on motivation, and the stages of change has already been taken by my good friend Loyola yesterday. Let me just tell you, friends, that I'm here today and taking part in the TOT because of intrinsic as well as the extrinsic motivation. Intrinsic because I wanted to learn something more from my peer group and my friends. And then Dr. Thomas, he was my motivator. He said, you can do it. And that's how I'm here. So everyone has got a reason for the change. It's sometimes from within and sometimes some external source. So Roshan, yeah, that's it. So module 4 says that. Can I have the next slide, please? All right, the training goals is to provide an overview of the concept of motivation, to understand the motivational process. And the rest has been taken yesterday. And learning objectives is list at least 3 characteristics of motivation. Can I have the next one, please? So what is motivation? It's come from the Latin word movere, meaning to move or to drive forward. Motivation is the inner psychological force that activates and compels a person to behave in a particular manner. It's a process of inductive individual desire towards a goal. That's the highlight of it. That is, it's an inductive individual desire towards a goal. Next one, please. The definition, can somebody read it out for me? Can I get the help of somebody?
Yes, motivation has to do with the forces that maintain and alter the direction, quality, and intensity of behavior.
Yeah, that's by Kelly. Thank you. Thank you so much. The next one.
Motivation refers to the willful desire to direct one's behavior towards the goal.
Towards the goal. So everything is towards the goal, and it has to be willful desire to direct one's behavior towards the goal. All these are very important as far as the person with SUD is concerned. It's not all that easy. It's very, very challenging for them. Okay, the next one. The types of motivation, the two types, that is intrinsic and extrinsic. Intrinsic motivation is a type of motivation in which an individual is being motivated by internal desires. And extrinsic motivation is by an individual is being motivated by external desires, as simple as that. The next slide, please. Now, what are the influences, internal influences on motivation? As it's written, emotional states. Can somebody tell, what are the emotional states in which we are? What are the various emotional states which we go through?
Yeah, we can be happy, sad, joyous, sorrowful.
Have anxiety.
Yeah, various types of emotions. So it may be some of these emotions, where even if it is a negative emotion, it may lead us to a goal, even if it is negative. Like suppose we are very angry, we are very frustrated. So all those also can take us towards a goal. And life goals also similar. If a life goal is there, we can pursue our life goals and we can reach the thing. And our perceptions also, how we perceive, how a client or a person with SUD perceives about the risk and benefits of behavior. And a cognitive appraisals also play a role in internal influence. Those are all the internal influences. Next one, please. External influences on motivation. That's for sure family and friends. That can also, the family and friends and the peer groups and all can always have a negative influence as well as a positive influence. So like for instance, a family where the father is already into drugs or alcoholism and all, so they will have that family, they'll have a negative influence on the children if at all they are into it. And similarly the peer group also, that's what happens with the peer group also, friends. And then the situations and experiences, again the same. It also happens where various situations also lead us to the to be motivated or not to be motivated also. Then the community support, the various community support also plays a role. And this is where even the self-help groups and, and people who have already experienced that, and, how we see the recovery coaches, everyone plays a role in that. That's an external influence. The next one.
Sulekha, also stigma will be an external influence.
Stigma also. Stigma is definitely there. Okay, the next one. 3 stages. That is sparkle. When the motivation starts, we call it the sparkle. And that's a need for change. That's one. And sustenance, when we find out our why and put in hard work to it. And amplify, when we increase the strength of it. The next one. Okay, the characteristics of motivation is dynamic. As against the earlier, the thing that is very static, it's always dynamic. It keeps on changing, and it has to be purposeful. It has to be intentional.
One second.
Yeah.
When you say dynamic, what does it mean?
Dynamic?
Yeah, when you say motivation is dynamic, what does it mean?
It's changing. It's always changing. It's not it's ever changing, I must say. What do you understand, Raman? Can you put
sometimes it can be strong, sometimes it can be weak, right?
Yeah, sometimes it can be strong, sometimes it can be. And purposeful with the intention. Intention is the third one. And it has to have a purpose also. And positive, and then changeable. These are the characteristics which they're mentioning about. Okay, the next one. Motivation for change is a key component in addressing substance misuse. This treatment improvement protocol reflects a fundamental rethinking of the concept of motivation as a dynamic process, not a static client trait. So it's not a static. I think in the group, it was put up the other day about about the client who wants to go back to drinking. If I remember correctly, there was one particular thing in the talk.
Yes. Jyoti ji showed it. Yes.
Jyoti ji had put it in that.
Yeah.
So it is what I feel. I don't know whether you all agree with me. It's both. It's a client. It can be static as well as dynamic. It can be, but mostly it has to be dynamic, because otherwise ongoing process will not happen at all. All right. The next one. Yeah, now change. Change is an important component of motivation. In every stage, whether it's in the recovery, whether it's a treatment, whether it's the recovery, or whether it is a rehabilitation stage, change is the thing. In our personal life also, we have so many changes. Every day is a change which happens. Change is not always easy for people. The stages change model, of course, it has been mentioned by Loyola. That's already taken up. The next one, please. Change occurs in our daily life among all people in relation to many behaviors with or without professional intervention also, not necessarily with the professional intervention. So in the case of the people with SUD, and for them also, not always a professional intervention is required, but when it's a chronic stage, of course, we do require it. All right. It's a motivation cycle which is given here. There has to be a need. At the beginning of the motivation cycle, a person has to have a need or a desire that they want to fulfill. Then there has to be a drive, a driving force. Once a person has identified the need, they develop a drive to fulfill it. And then the action, that's when you take the step to fulfill the need. In this stage, a person takes action to fulfill their need or desire. And then the feedback. Feedback is an essential component of the motivation cycle. It provides a person with the information about their progress towards their goal and help them adjust their approach if necessary, and then the goal attainment, then finally the stage when you attain the goal. In this also we can mention about, suppose a person with any kind of a substance use is into it. He goes to, he's working in a particular office, and he has the focus, that is, he has the need to do well in life. He needs to be appreciated, and then he has to drive for it, and he has to get the feedback. Once his boss or his other fellow employees give him a positive feedback, that motivates him to do better, and then only he can attain the goal. All right, the next
Sulekha
one.
Madam, one question I had about that goal attainment.
Yeah, goal.
Is it common for people, once they attain the goal, does the motivation drop?
It can. It's not always, that once you're motivated, you attain the goal. I think, it fluctuates even there also. It's not only one goal you have. There may be so many other goals, So it's not, I don't know what you are the better. You can tell me, can you just put some thing into it?
See, the thing is, I'm relating especially to people with SUD. They have to learn of new ways to celebrate, because once they achieve a goal, how do they celebrate? They can't use drugs or go to their party friends. So
no, that's correct. But the goal is, goal is to stay away from it. The main goal is to stay away from it. That's it.
Yes.
The
So
main
that
goal
is
to
a
stay away
sustainable
from
goal.
it, and
Yes.
That's true. That's true.
Thank you.
Then we motivational process is about the same. When we say, unsatisfied want is there, and desire, for example, desire for promotion, but you're not getting it. So what happens when there's an unsatisfied want? It leads to frustration, and we become uneasy, and then the drive. We look for some alternatives, regarding that, and the behavior. We behave as per alternative, and then once you get the satisfaction, that is, follow the alternative until satisfied, then the frustration level decreases. So this is how the motivational process takes place. The next one, please. Stay motivated and focused even when faced with big challenges. Think big. You have to think big. You just can't leap up and just overnight reach the goal. And instead, act small, day by day. Take all the challenges and then only go up the ladder to success. Now, this gives a whole picture of what is motivation. Yes, the idea, then the performance, the goals, encouragement, support, attitude, everything together leads to motivation and of reaching the goal. And this is how, and this one, next one, please. This is self-explanatory. Can somebody just elaborate upon that? It's a picture which shows, So it's just a simple one, I suppose, simple one of, of course, it's as simple as we can say, but it's a Herculean task to reach that. And where there we can see the vehicle which has already crossed the treacherous road, and the other vehicle is being motivated. The people are motivated to reach the goal. So this is it about motivation. Thank you so much. Thank you.
Oh, thank you. Thank you, Dr.
Thank you,
Sulekha.
Sulekha.
You
I think
made
I
it.
hurried up a
Okay.
little bit.
Congratulations. Anyway, Aditi ma'am, your comments.
Yeah, a very clear diction. You elicited a few examples, but I was expecting more examples in this particular topic. Every point could have been given one example from practice, actually. You involved a few participants, but again, I thought you could have involved more because this is a topic where you can involve and make people talk. Again, too many slides. According to me, you could have reduced it to half. And I personally felt it was very rushed up. You wanted to just finish it fast. You were in some kind of a hurry to, you're just reading through the slides and wanting to come to an end. So you could have, gone very slowly, calmly, given more examples, especially for internal, external motivation. Every little slide of yours could have been given some examples. So I think, otherwise, a very clear diction. You've understood your topic well, but I think you need to a little bit calm down when you give presentations.
Thank you, ma'am. Thank you.
Yeah.
Thank you.
Yeah. Again, the same thing, but I want to tell you, you are a good teacher. But in order to be a trainer, you have to be a minimum passenger level, not a Vande Bharat level. You are going.
Yeah, true, true.
Your language very simple, very clear. All those things are very good of you. But I think you are used to lecturing people, so you just transformed yourself into the training, So like what Aditi ma'am said, go slow, give examples, ask people to talk. All these things are good. Definitely you can make a good trainer. Only you need to pull your speed a little bit low.
Right.
And ask
Raman helped me out a little bit too.
Okay.
Thank you, Raman.
Thank
Thank
you.
you,
Thank
Raman,
you.
for it.
Thank you.
Thank you.
Thank you.
No, I had the challenge of the thing also,
Internet.
I mean, it's raining
Internet.
very heavily, cats and dogs,
We
thunder,
understand.
lightning. So I was a little worried. It was just, I mean, that was one of the reason, but it's not
We-
a reason. Definitely have to learn. I
We
have to learn.
understand. We
Yeah.
understand that. Okay.
Because Tula Varsham, Francis sir,
Yeah.
it's very bad
Yeah.
here.
Yeah.
And the lights are going off and on.
It's
Yes,
creating problem here too. I'm also in trouble now.
I know.
Yeah. Good.
Okay, thank
Thank
you so
you.
much.
Thank you.
Thank you.
Yeah.
Okay, Sulekha ma'am, I should appreciate you because you are not that confident because of the Tula Varsham, I think.
No, really. Yesterday
Because of,
also off and on. I
the
don't know, somehow.
rain. Yeah. Even today you are not. No, then I I had to little bit pull you up. So, but that is one of the reason why maybe that you were hurrying to finish it before your
Yeah, I
internet
could have gone a
fails.
little more slow, I could have gone a
Yeah,
little more slow.
that's fine. That's fine. I mean, we can understand also. But some of the lessons we need to learn from this is, of course, in the online presentations. There are so many things we have to depend upon. Internet is one, and the external climate, and so many things are. But we have to keep all those things in mind, and then also we can plan accordingly. Because you had a very nice topic, and your voice was very empathetic. I should say that. Somehow it caught the attention of the people because you are very empathetic too, and you have been a teacher all throughout your life. But you are also as simple and humble as a student also. Since you have both the things, you were able to really communicate from that empathetic tone. So whatever you have done in these 10 minutes, I would say it was excellent. There was no doubt about that. Some of the points raised by Aditi ma'am and Francis, you have to keep in mind. I don't want to repeat that, but I can be sure that you can be a good trainer because you started practicing it also. Like you are going to the students, you are a counselor, so all these things. Despite the fact that you are leading your retired life, you are very active. So continue, ma'am. We need people like you, so passionate and committed to the cause. So congratulations.
Thank you so much. You're always motivating, really. That's really good. Thank you so much. Thank you.
Thank you. So we are 1950. I'm sure there may not be anybody today, I think. No, is there anybody who are planning to do?
Dr. Thomas, I have a suggestion.
Ah.
Those who don't present on the assigned dates should
Yeah,
be
yeah,
given
yeah, I
some
have-
sort of punishment.
Punishment is only if we get time at the last day, we'll give them. That's all. Otherwise, they
that's
will lose
okay.
their presentation.
Okay, I have another
opportunity.
suggestion.
Yeah.
Thomas, now ask for the names who are going to present on Friday. Let's have the 6
Yeah, yeah, in
people's names
advance week,
right
yeah.
now. Yeah, right now.
Yeah.
Okay, just we have some
Who's the
little
first
time.
one
no?
who's going to present?
Ronnie may take note of that.
Ronnie and Roshan take note. I don't have a pen now
Yes.
with me.
And if I may take a moment to
All
thank
right,
Roshan,
all right.
he has been giving all the slides. He's been conducting the slide work. Thank you.
Roshan.
Thanks a lot, Roshan. I should have said please a little more. I was just saying next slide, next slide. Please don't take me wrong. I should have said please, like Sulekha madam so sweetly. She was saying please, next slide, please, next slide, please. Sorry, I didn't mean it. Yes.
No, Raman, we all understand that. I think Roshan understands that.
That's absolutely right,
Roshan did a
Raman.
lovely job. That's what.
Raman,
We are not tech savvy. I'm not tech savvy at all. I would
Yeah.
have been all the more tense.
That
Yeah.
language is okay because we are all in good company.
So,
no?
Ramya, you are going to go first?
Thank you.
Yes,
Yeah.
ma'am. I'll
Okay.
go.
Thank
go
you.
Ramya one, then
Ramya, thanks.
Liba.
Who's the
Liba
second
is
one?
also on third, no?
Liba.
Okay, 2. Who else? According to the schedule also you see, okay, because if there is no change, then they are the people who are supposed to.
Yeah, who's the third one?
Ma'am, I can present third one, ma'am.
Who's that? Nima?
Nima,
Okay.
Nima,
Great.
Nima, third one. Okay.
Good job, Nima.
Then another 3 more.
Nobody wants to present?
We are going to take it from by the flow. So Nisha is in front of me, and then myself, and then Nima. That's how our.
No, but Sunisha, are you there?
Yeah. Sunisha?
Sunisha.
Yes, I'm here. Sorry.
Will you
I just
present?
jumped out of the meeting.
Yeah, will you present?
I'm currently traveling right now, so I'm
Not today, not
having
today.
a challenge
Third
network.
of
Even
November.
on Friday, I'll be
third.
traveling.
Then you will lose your chance, I think.
Okay, then after Sunisha, who's
Okay.
next?
Shalini Sagar? Done, no?
I'm Jyoti. I'm going to present after Sunisha, ma'am.
Oh, Jyoti. Okay.
Jyoti. Yeah, okay, done. 4. Shalini?
According to the schedule, Shalini is supposed to be first after Ramya.
Yeah. Order, okay, but.
Okay,
I mean,
so
just-
Shalini, I'm writing your name. Are you there?
Yeah, she's not here.
Oh,
I think she lost.
No, if it goes in order, is
You can
good.
put it
If
on the
next
WhatsApp group.
topic.
Who's presenting the next?
Yeah, you can put
you
also
put it
that,
on the
yeah.
WhatsApp group. The list of
And
people
Avijit
presenting.
Singha has replaced with somebody else, no? Who was that? Who was supposed
Sir, I replaced Raman.
Raman, Raman did today anyway. Okay, fine. So then Manish or anybody else also can, because we don't have to keep all 6 people on the last
yeah.
day.
So we have
One
Ramya,
more person
Liba,
from the
Nima, Jyoti, Shalini, and one more.
Sunisha?
who from
Sunisha?
Sunisha's traveling, it seems.
Okay.
Chatura is not
somebody else
present.
from November 7 back. Huh?
Chatura.
What about Sabati?
Sabati already presented.
Oh, already finished. Okay.
Yeah.
Sabati did.
Georgish, what about
On
you?
the first day, he did. Georgish?
Georgish, can you present?
Okay, I will present. No problem.
Great.
So today Geta did not come. So I think
Yeah.
he can present next.
At the, I mean,
No, so I think Ronnie, Ramya, Liba, Nima, Jyoti, Shalini, and Georgish. Now, after
Tomorrow,
that,
yeah.
if we have time, then Geta can do.
yeah, that's
Okay.
all.
Because
Those
these
who
people
are-
are already confirmed now.
Correct. Okay. That's
Huh?
fine.
So we'll keep him on the. Except
Okay,
Shalini
great.
doesn't know. Shalini is not here.
We will ask
It
her.
may be
yeah.
okay with her because she's maybe checked out and
Yeah. Okay.
So congratulations to everyone who did today. Good job. It was nice. I think almost Everyone did well. Good. So yeah,
Sir,
Shitali.
I have one suggestion to ask. Can I ask?
Okay. Yeah.
Those who are presenting on the day of coming day, usually what I want to say in the first day also, but I couldn't get time to say. Will we get someone of demo something, not to do it on our own behalf of presenting the slides by our own to access it to the method, because we are logging in earlier than the scheduled time. So those who are presenting, will they get some demo of seeing it 1 or 2 minutes?
You can contact Roshan. He will be there to help you at any time.
That can solve all the technical problems.
Georgesh, you can
Practice.
stay after the meeting today itself if you have time.
Or if
We
you
will
are
be
ready,
here.
if he's not ready with the presentation. If you're ready with the presentation, I'm ready.
Yeah. Because the link is prepared and shared with you at 9:30 in the morning. So the same link will be there. Anytime you contact Roshan, he will help you. So he is very nice boy. So use that also, no? Whatever help from other places, you take it. But give a good show, no?
Yeah, I usually call him individually and talk to him, but this is for all of us in order to solve all the technical issues.
Yeah. Thank you,
Sir,
George.
Georgie
But you should have told.
telling about the technical issues only. How to share slides, etc. like this.
Then I would suggest Dr. Thomas. If you can do a session for everybody, I mean, those who need the technical assistant, tomorrow maybe half an hour. Is it okay? No, tomorrow you are busy, no?
Tomorrow, no. I mean, that we will give. Anyway, let it go like this. Individually, you contact Roshan for technical thing. And after these presentations are over, we will do that. Because in between, no, otherwise schedule will get affected, no? Let it go smoothly.
Right.
We will end with that technical, because online training, we need to definitely give technical training also, no?
Yeah, that's true.
We can do that.
That's fine.
Yeah.
That's fine.
Aditi,
Dr.
ma'am,
Thomas,
yeah.
can you give a reminder for those who have presented to post their PPTs so that we can go through it once more to revise and just get a refresher? Because some were rushing through and not able to read the full slide properly and, assimilate everything. It'll be good if they can post it. Because I have posted, but only 2 of us have posted. Nobody else has posted their PPTs.
No,
but
I
we
didn't
cannot
post it because I didn't cover my whole slides, all the slides. So, but I can post.
No, post it. It doesn't matter if you've not covered. We can read it, no?
Yeah, they can post a PPT, and I can also send a YouTube live YouTube link.
Yeah.
To the
We'll be
WhatsApp
sharing the YouTube
chat
live
group.
also. So to everybody, like all the presentations are recorded already. We will share that also with you. And presenting your slides in the WhatsApp group is voluntary. Okay, we are not compelling you also. If anybody don't want to present, absolutely no problem. But this is okay, good. If you present, others can also get help out of it. That's it.
It is shared information, like it helps everyone to grow.
Yeah. It was a good proposal, yeah. Any doubts, anything? Madam, anything?
No, nothing from my side.
Okay, so we have 2 minutes. Good. So get ready for the next day presentation. Those who are presenting little late, you get a lot of ideas, okay? So you are highly privileged people. Those who are done on the first day and all, they didn't have that, not so much of ideas. They're getting it from you all. Okay, so enjoy. Have a nice night. Good night.
Good night, sir.
Good night.
Good night, everybody.
Good night.
Thank you.
Good night, all. Thank you.
Good
Thank you,
night.
ma'am.
Thank you.
Francis.
God bless.
Yeah.
Bye
Good
bye.
night, everybody.
Thank you. Bye-bye. Bye. See you. Sheetal, Clara. Good. Suman.
Thank you.
Thank